Welcome to the Gender and Health Hub. I'm going to take you through just a few of the features of the site. The site has been designed to both position the hub as a hub of all hubs, but also to ensure that information is easily found by the user. It's human-centered, sophisticated, while also simple and intuitive. Here we have the homepage. The split screen metaphorically represents the coming together of gender and health. The site is designed to publish and highlight regular resources, content, evidence, and data as it's released. It's a site to be visited regularly and a tool to be used in the integration of gender and health. The content and the design is dynamic. So back to the top, we feature suggested and trending content, which you can see here. As you scroll through these featured articles, you'll see the images change based on what article you're sitting on. It's simple, it's sophisticated. Accessibility has been considered across contrast ratios and colours. And here we have a really complex and intuitive search tool that's been made simple. So you can search by region, you can search by category, or you can filter down and search by topic, keyword, or disease. For example, it uses predictive text to show you what you might be looking for as you're searching. This makes the user journey efficient and effective and encourages the user to understand what they could be searching for. If a user doesn't know what to be searching for, they can always scroll down and they'll find here the latest evidence, resources, and events, which they can scroll through there. So the user journey has been considered at every step of the way, and it informs all elements of the site, including hierarchy of information, dynamic content, interactivity, engagement, and functionality. As we scroll down, the search bar locks to the top of the page, so users can always come back to that, because at the end of the day, this is about giving you the resources you need to better integrate gender and health. It's not your generic navigation, but a global tool to support efforts in gender and health. As we go down, you can search by category, which you can see here we have 10 categories. You'll also find upcoming events, latest news, and you can click through to learn more about the initiative or go back to starting a search here. And here we encourage everyone to sign up to our newsletter so that we can keep you updated with new resources as they're published and ensure you're up to date with everything happening in the space of gender and health. Now, if we click through to a category, you'll find a list of resources that you can filter through more options. So for example, here you can add in date range, type of content. So we have a lot of different types of content on the site, or you can sort by things like oldest to newest, most popular, or in alphabetical order. As we tend to scroll through these resources, you'll see there's 3 key points that kind of tell you what's a little summary of what's in these resources, as well as the ability to like and interact with this content. It'll also tell you how long it will take to read the full resource and the region as well. So for example, if we click through to a journal article here, you'll find all the information around how many views it's had, how many likes it's got, who the authors are, and again over here you can actually like the resource, or you can easily share it with someone in your community, in your networks, or on social media. Again, you'll find the region here as well as the time it'll take to download and read the full resource. Here, as we scroll down, you'll see there's a sticky menu, so you can easily navigate between the 3 different sections. And within each resource, you'll find really synthesized, accessible, inclusive content. So we've done the work of highlighting what you'll learn and including key takeaways for every resource so that you can really easily and quickly find information that's relevant to your needs. It's inclusive, it's bold, it's engaging, and it's interactive. Down here, you'll notice we have a take action survey. So in order to actually download a resource, what we're doing is we've popped in this take action survey so that we can find out more about how this hub can actually serve you, our community, the best. So we ask 3 short questions before you download a full resource. And this helps us to find out what was actually useful about this resource, how useful it was for you, what would make it more useful. So you could, if it was perfect, then you might write something like this. And if we click through, who else might find it useful? So if you pop in there, email address, we'll actually share it with them for you. And lastly, then you can download the article or you can share it on social media as well. So this shows us what content you want to see more of and need to support you in integrating gender and health. Underneath, you'll find related articles as well. So really, this is just the beginning of the Gender and Health Hub. Ultimately, our goal was and is to make something that is simple, sophisticated, and intuitive. That's here not to duplicate efforts, but to really amplify and support efforts in this field, from evidence to policy and action. So we hope you love it. We can't wait to hear your feedback and to be able to take that on board for stage 2 of the site and in the future as well.